last time we talked about your general impressions, we talked about smell, odors, we talked about being descriptive, we talked about how we kind of replace the human a little bit. But then we said, I started asking about what you first noticed, and one of the answers was vision. So that's true. You know, that I think is a very powerful signal that we have. We get with our eyes, the colors that we see. So we'll talk about the colors that are associated with the human body and disorders, some disorders that cause distinctive coloration. We'll talk a little bit about some medical diagnostics that are based off from light and color. So, I keep referring back to the documentation of the physical exam that a doctor makes. Last time we kind of talked about the general impression. This time we're going to talk about how some of the vitals are measured and the colors and what you see really influence how you look at the skin or the eye or the ear, nose, throat exams. That's what ENT stands for. But first, reference back to engineering exams. So this is from a failure analysis book, and it says the preliminary examination should begin with the unaided visual inspection. The unaided eye has exceptional depth of focus, the ability to examine large areas rapidly, and to detect changes in color and texture. Some of these advantages are lost of any optical or electron-optic devices used. So remember that. You need to look at something and eyeball. You know, there's a reason people say go eyeball. You know. And again, sticking in the engineering realm, I want to describe what liquid penetrant is, because it's something that if you do any kind of failure analysis, you'll probably run across this. It's like 50% of all non-destructive testing that's out there. And so this is an example of liquid penetrant. So you take a liquid, smear it all over your sample. This was a spar strut from a Cessna airplane. And we were looking for cracks because some eddy current testing showed some cracks. We didn't find any. But so this is just the liquid smeared over there. If there was cracks, the liquid would get into the cracks, and then you wipe it away and you wouldn't see it. And that's what you can see. I can pass this around. This is had a lot of cracks, and we did the liquid penetrant. And you kind of still see a little bit of the pink left over in it. It rubs off after a while, but that's not so critical. And then this is a standard book of standards or examples of different liquid penetrants. You can put a fluorescent dye inside the liquid to make it easier to see where the cracks are. So you can pass that around through the class. So speaking of UV, since we're talking about color, UV is not only used in engineering, but physicians, particularly dermatologists, use it. This guy named Robert Wood was the first to kind of popularize it. So using a lamp that has 360 nanometer light, in medicine they call it a Wood's lamp because they don't talk about ultraviolet. It's too technical a term, I guess, I don't know. Medicine likes to name everything after the doctor who used it. And so you can see some fungal infections kind of glow a bit. That's sometimes do this too, like ringworm on an animal, but you can see ringworm on humans too. There's I'll talk more about this, but porphyrins can sometimes have a skin component, and they actually kind of glow red. But the big thing that you notice with UV light is something else, and I'm going to show you. So it might be kind of hard, so you might want to stand up a bit closer. I can't really bring this around you all. Maybe people are trying to describe it. First of all, see anything on my arm right around there? Yeah, it looks pretty normal, right? Here. I'll give you a third hand.
Since you're using one of
Well, the problem is I can't get closer. I don't need a third hand.
Well,
people need to be closer to see it. You have to come up.
Oh, if you want to come up.
All right. See that? You've never seen that with your naked eye. It's not. This isn't like amazing or anything like that. It's just a darker spot. It's a darker area. So why does you? This is 366, I think, nanometers. Light. Just refer to the turn of light so you can see that there's no. You can kind of tell now that you've seen where it is. There might be a little bit darker area there. That's just some place where I scarred myself. I burned it or something like that. So that's a kind of more obvious example of what's going on. So what is, so the UV light is being absorbed in that dark area, right? That's why it's darker. It's not bouncing back out. So what's absorbing UV light? What gives skin color? Melanin, right, melanin. So why do we have that? So they think, can't go back and ask, but they think that human ancestors, when they lost their hair, they lost it because they became bipedal. They started walking on their hind legs. And they started running. And they started sweating a lot. And so the ones who lost hair were able to manage their heat better than the ones who didn't. So it was an evolutionary advantage to be lose hair, not to have fur. And as a matter of fact, humans are some of the best long-distance runners of all the mammals. We can now run horses. We can now run almost any mammal, which is kind of critical if you're living out in savannah and you're not really adept at tools yet, and you want some meat in your diet to feed your hungry brain and so on, because meat's very energy dense. And you see some vultures, buzzards, circling around somewhere off in the distance. And it's kind of a distance because it's a big flat savanna, right? So you take off and jog after it, and your goal is to beat the hyenas. So there's a lot of there's a number of physical anthropologists who think that that's why humans, a lot of the human traits that we have are the way they are, so that we can be long distance runners. So so we lost hair, but then there was like a mega drought that they know about from the geologic evidence, and so they think that drove humans into dry, arid, flat areas with a lot of sun exposure. And so the people who developed more and more melanin in their skin, they became darker skinned, had more skin protection. If you ask the average medical professional what the advantage of melanin is, they'll say skin cancer, to prevent skin cancer. But if you think about that, back when people were dying in their 30s and 40s, like by 30, what kind of evolutionary benefit is that, right? They probably weren't dying from skin cancer. So there's a theory that's gaining more prominence that it's to protect from folate from being decomposed. So folate's an important nutrient. We need it to prevent, if you don't have enough folate as a woman, you run a high chance of having your children have spinal bifida or other growth defects. And so that's definitely an evolutionary benefit to be able to maintain folate in your body. So there's actually a couple different types of melanin. There's eumelanin, which is, there's two forms of eumelanin. One more black, one more brown. And the color that you see in people is kind of a mix. It depends on the person, these different forms of melanin. So why not melanin? So obviously there's people who are darker than others. So as our human ancestors started migrating out of Africa into more northerly climes, the melanin became less of an advantage because there was less light to destroy the folate. And now there was less light to make vitamin D. So vitamin D is a pretty important nutrient as well. And so it's been associated with, low vitamin D seems to be associated with stillbirths. There's some theory that it may be related to tuberculosis, so both those things would affect would cause an evolutionary pressure. For modern era, there seems to be evidence that low vitamin D may be associated with high rates of cancer or high rates of depression. So get your vitamin D. It's easy to get vitamin D just outside for 15-30 minutes. Also, in this migration to areas with less sun, there was another mutation in melanin that started making pheomelanin, which is the reddish color. So in Ireland and Scotland, that's where most of the people who have the reddish hair and skin are colored by the same melanocytes, the cells that become. So you see great variation in skin just from one type of molecule, melanin. And this is the regions of where native peoples were found. They mapped it by skin tone. Here's another one. So Scandinavians are just an interesting thing. That little region in the world is the origin of some of the more pale people, right? Why that little region? Anyone know why? Between Oslo and St. Petersburg live 90% of all the people who live on the 59th latitude. Why is that? Why do they all live right there? Of all the people in the 59th latitude. It's warm, that's right. The reason's the Gulf Stream. The Gulf Stream brings up the warm water and it warms up that part of northern Europe. And so that region is really far north. It only gets like 6 hours of sunlight during the winter, or at the depth of winter solstice, 6 hours of sunlight. So it's pretty dark up there. So they need all the sun they can get, so less melanin. As a physician, you can categorize someone's skin tones, you can give it a number. We talked about quantification last time. I think dermatologists do it, I don't know any other physicians who really care. Let's talk about light and aging. So the skin doesn't really age. It sags with gravity a little bit. You lose some fat pads under your skin, it makes you look a little bit older that way. But the skin itself doesn't particularly age. It actually photoages. Light is what makes skin look older, or actually makes it. Smoking does too. If you don't believe me, these are twins. Who do you think has more sun in their life? Yeah. You can have drastic differences in how old someone looks just from how much sun they get. This is a truck driver. Some people have seen that picture before, but his left side of his face got so much sun because that's the side the window's on, driving in the United States, right? And then this is these are two twins. One's a smoker and one's not a smoker. Who's the smoker? Yeah, the one on the right. Smoking makes a big difference in how old someone looks, just from the skin. It's not really exactly clear how it does that, whether it's from the particulate or from something systemic. But smoking has does a lot of bad things besides just lung cancer. So, hyperpigmentation, when you get lots of melanin, what causes it? Well, obviously sunlight does. It's called tan, right? Birthmarks can do it, melasma. There's a disease, an endocrine disease, a couple of endocrine diseases that can do it, and a insulin disorder. So birthmarks, you can have vascular disorder, so I'll talk a little bit about how the vascular system affects color. But also you can have pigmentations, whether it's just like more of the melanin pigmentation, so brownish, or you can actually have some gray spots. That's called Mongolian spots. Kind of more common in people from East Asian or Native American heritage. Melasma is an endocrine stimulation of melanocytes, the cells that make melanin, common in women who are either pregnant or taking contraceptives or hormones. Often they fade when pregnancy or the hormones stop. Cushing's or Addison's disease, that's two different diseases, but it can have similar effects. The pituitary gland can get too active. Your pituitary gland control is kind of like the master center for hormones of your body. And one of the hormones it makes is called adrenal-corticotropin hormone, or stimulating hormone. And it actually breaks down and forms a melanin-stimulating hormone. And so if your pituitary gland is too active in that way for whatever reason, it can actually give you a tan. JFK had this healthy tan because of this. He actually was taking like 10 to 20 minutes throughout his presidency that people never knew about. Their own hormones and things like that to manage his acid. Back then, people didn't know the medical state of the president. Acanthosis nigricans is some brown to black velvety regions, usually in skin folds. It has to do with insulin resistance. So diabetic, so people who are obese sometimes do. It's fairly benign, but you notice it in this position. So the reverse, hypopigmentation, what can cause you to lose melanin? So vitiligo is, they think, is an autoimmune, maybe viral attack on the melanocytes. And so you lose melanocytes in certain parts of your body, and it can be quite noticeable and disturbing to some people. You can have a fungal infection called tinea versicolor, and the versicolor means you have different colors. Kind of the fungus can mess up the melanocytes in those areas. And then albinos. You've all heard about albinos. We talked about phenylketonuria last time, the amino acid disorder. Well, phenylalanine is one of the precursors to melanin. So if you don't have phenylalanine, you don't make melanin. So they don't develop that shade of brown that we're familiar with. They're not completely white. Why? What color would you say is albino? You wouldn't say white necessarily. What would you say? Yeah, kind of pink. Let's make it pink. Yeah, blood. So before we talk about blood, there's something else. There's another shade in there that's a little more subtle. Maybe a shade of yellow. So carotenoids are molecules usually from vegetables, other plants. They're antioxidants, so they're good to eat, but they're colorful, which there's a correlation between color and antioxidants. But you eat them, it tends to get stored in fat, and you kind of sweat or secrete them out, and as you do, it gets absorbed in the upper layer of your skin, and it gives you a yellow tone. There's a couple studies I've read about, this is from one of them, where they had volunteers Photoshop people. They gave them two sliders, one that corresponded to more or less melanin, or the tone associated with that, and one associated with the tone that's more or less carotenoid or yellowish color. And they had them adjust the sliders to make the pictures more attractive. And they tended not to mess with the melanin slider very much. It was more the carotenoid color that they adjusted. And so the theory is that we find, and this goes along with the theory that attractiveness is associated with healthiness. And so the theory is that we tend to find people to be more attractive / healthy looking if they have more of the carotenoid in their skin color as opposed to the melanin. So the bottom line is, get your sun by eating. Okay? And don't eat, and it also prevents aging. So blood, we talked about blood. The blood that gives us color comes from the dermal capillaries. You can kind of see veins, but they're kind of deep, too deep to really give your skin the color the pink color that we have. It's more from dermal capillaries. Visible light in the seawater or the body, which has about the same conductivity as seawater. It's only like 10 microns deep. That's as far as it goes. It's skin depth. So no blood makes you pale. Extra blood makes you pink, like if you're blushing. Deoxygenated blood will make you blue. And then I'll talk a little bit of some other things that happen with blood. So blood is made up of hemoglobin, and the heme part of hemoglobin is synthesized this way. It's a long, big, complicated thing. The point is that there's a lot of precursors to heme. And if there's a disorder, this is kind of inside, if there's a disorder in that, it's called porphyria. So the porphyrins are the precursors of heme, so you have porphyria. And so you get porphyrin buildup in the body, and that picture I showed with the UV lamp earlier that glowed kind of reddish, that was a porphyrin buildup in the person's skin. You can pee out porphyrin and make some dark, almost purple urine. Some people think that King George III, the Mad King George, you might read about in England, had porphyria, and that's what made him kind of crazy, because porphyria can make you crazy. And there's some anecdotes that he might have had weird looking urine. There's debate about this. Obviously, you can't go back in time to go check. And there's also people who think that the legend of vampires may have been related to this, so you can look at it as well. That's an example of what happens when people get hit with light who have a cutaneous form of this porphyria. They react strongly to the light because the pigments, these porphyrin pigments, interact with light. You can actually use that as a medical treatment. So you can take a person who doesn't have porphyria and inject them with porphyrins. You can do different techniques to get the porphyrins to localize to a certain part of the body, or you can take a fiber optic light source and shine it, just have a laser to shine at whatever you want to burn, make it look like that person's hands, but just where you're shining the light. So that was actually one of the first surgeries it wasn't really surgery, the first medical procedure I ever was in an OR for, is this called photodynamic therapy. And what you do is you give the patient porphyrins several days before, so that it metabolizes, get throughout the body. They have to be in this dark room so that visible light doesn't hurt them, because it'll hurt wherever light hits them, until they metabolize all the porphyrin out of the body again. And then you bring them down to the OR all covered with drapes and stuff like that, so the light doesn't hurt them. Get them in the OR, and they have it all dark like that. They have them all covered up, so only where they shine the light. In this case, what I saw was esophageal cancer, so they stuck the fiber optic line down the person's throat to the point in the esophagus that they wanted to burn. And meanwhile, me as the new medical student, instead of asking questions like about anatomy, like most medical students were asking, I was asking questions about what the diffuser was made out of, what they was in the fiber. And a fellow who had been in training for 10 years after medical school, he was one of the more well-trained people I've ever met, was kind of giving me weird looks. So anyway, hemoglobin. So you take 4 hemes, you take 4 globins, which are proteins, and put them together, and you have hemoglobin. And each of those iron sites, if you remember from the heme picture, I don't know if you noticed that, there's an iron that sits right in the middle. And so oxygen can bind to those sites. So you have 4 different sites there. So oxygen can bind. And so hemoglobin is red. That's the color. We know that. So if you lose blood or you're anemic, such that you don't have a lot of hemoglobin, because you don't have enough iron to make the hemoglobin, then you start looking pale. Vasoconstriction is the contraction of blood vessels. So you have small blood vessels in your face that if you get scared, sometimes you turn pale because the blood leaves your skin. Diabetes, peripheral vascular disease can actually damage small blood vessels, and so sometimes diabetics might have a more pale look to them, or their feet might be pale and shiny instead of being ice red. You can look at someone to determine if someone's pale because they've lost blood, or they're or because they're just pale. What you can do is you look at their eyelid, and right at the edge of your eyelid should be always pink. I don't know if you can see that on me, but there should be like a pink line right there. If it's pale, then the person's probably got some blood loss or they're anemic or something. You can test to see if someone's flowing blood well. So take your finger and just push on it for like 5 seconds. And then lit it up. You see how it's pale and then it turns pink again? Most people, they'll turn pink within 2 seconds. It's kind of a rough estimate of how well someone's perfusing. Hyperemia just means lots of blood's flowing through a certain area. So when you blush, that's a little bit of hyperemia. Blood vessels dilate, more blood gets there, you turn more red in that area. Inflammation makes blood vessels open up, makes them a little bit more porous. Blood flows to that area. That's why things turn red. Usually that's temporary, or hopefully it's temporary. Long-term inflammation or radiation, which is in a way kind of an inflammatory thing, or if, for whatever reasons that part of your body's not getting a lot of oxygen, you can damage the blood vessels and they can kind of permanently be like enlarged and let blood through. cancers sometimes distort the vasculature in that area, so blood vessels get rid of the blood, so blood kind of pools up there. So these things can make red parts of your body. That's why things swell up, because blood is getting into there, not getting out. So if you have an infection, blood's getting in there, not really getting out. So it's swollen. There's more pressure there. We'll talk about pressure with touch in another lecture. But it's red. And so that was one of the original descriptors of what is inflammation or infection. Remember, sometimes you hear of blood cancer, which is from the Latin color, which is heat, vobor, which is pain, rubor, which is red, and tumor, which is pressure or size. So tumor or tumors, that's something that's enlarged. Another side, your nose actually has some erectile tissue in it, and can get more blood in it. And so if people lie, we kind of have an some people more than others perhaps, but it's kind of an involuntary response where the nose feels a little engorged, a little bit enlarged. People, it bothers people, so they tend to touch their nose when they lie. So if you think someone's lying, look and see if they're touching their nose. In the clinic, you can look for areas with more or less vasculature. So one area of rich vasculature is the retina, lots of blood in the back of the eye. And a quick test to see if light is getting from the front of the eye or outside the eye back to the retina is to look and see if you get that red light thing that you see in pictures sometimes. And it's usually done by pediatricians because you want to diagnose this in a kid. You don't want to meet someone when they're like 50 years old and figure out that they've been blind in one eye or blind. So the idea is if you don't get red light or the reflection of the redness from the retina coming out, is that there's something blocking it, whether it be a retinoblastoma, which is a tumor that's often found in kids, or cataract that's occluding the lens, or some kind of corneal defect, what have you. Another thing that you see with kids, but also adults, if you have an ear infection, you can look in with your otoscope inside the ear to the far left there. That's a kind of a normal looking tympanic membrane, your eardrum. You kind of see the bones that strike on the drum, the bone kind of through there. You can get infections that'll cause the tympanic membrane to kind of swell. It'll also make it red. So some people are concerned if the child is upset, which often they are if they're in the doctor's office, they're being poked and prodded, things are stuck in their ears, that it might make a false diagnosis of an ear infection, but they've actually proven that's not the case. It's hard to make a tympanic membrane red unless you actually have an infection. Your tongue has a lot of blood vessels in it, and if you don't get enough vitamin B12, you can get a big swollen, they call it beefy tongue. So basically there's a lot of blood gets to the tongue, kind of pushes it out, stretches it. And some other tongue disorders, I just threw that in there. It doesn't have much to do with blood, just it's kind of weird tongue colors. So, talk about having too little blood, too much blood, or more than average blood. What if the blood is there, but it's deoxygenated? So deoxyhemoglobin has a different color than oxyhemoglobin. Like everyone knows this, you've got arteries and veins, and everyone talks about your blue blood in your veins. It's not quite blue, it's just a really dark, kind of red, purple. Just kind of looks blue through the interaction with the other pigments that goes through the skin and stuff like that. But it is darker, it's a different color than arterial blood that has all the oxygen. So you can actually see a bluish color in someone's face if they're like choking. People turn blue, it's no lie. You can, like little babies sometimes are born with a heart defect, and so they'll be blue because they're not getting oxygen. The whole baby is blue because the oxygen is just not getting from the lungs into the blood. Sometimes people aren't oxygenating the blood enough, so when it leaves the heart, it's oxygenated, but as it gets to the periphery, it is deoxygenated. And so I'm simulating that right now. I just put a rubber band on my finger, and what's happened is blood's in there, but the cells in the tip of my finger are using up all the oxygen, and as it does, you can see it's starting to turn darker, right? That's cyanosis. A little more script of the picture is this. It's actually from a syndrome called Raynaud's syndrome or phenomenon. But they have a vascular disorder that causes blood to get stuck in the tips of their fingers. This isn't quite cyanosis, but you'll hear about blue sclera. So the sclera of your eyes, or the whites of your eyes. And in babies, in the particular disorder called osteogenesis imperfecta, the sclera is pretty thin, so you can see the veins more easily. It makes them look like instead of white stuff, blue eyes. If you ever saw Unbroken, that Bruce Willis in that Shyamalan, Samuel L. Jackson plays a guy with osteogenesis imperfecta, but it's kind of a rare disorder. So, what's that mean for us? How many of you have taken a flashlight and done something like this? Made your finger glow, your mouth glow? Who doesn't do that, right? So, a guy in Japan, this one works pretty easily. That on your finger. Some of you have probably seen this before, maybe all of you. This is a pulse oximeter. Turn that on. So you are shining a light through your finger. So you have two LEDs, one tuned to 660 nanometers, one tuned to 940 nanometers. And they're both on one side of the finger, and then you have a photodiode on the other side. And what you're doing is you're measuring how much light gets through. And so oxyhemoglobin tends to absorb the 940 nanometers because it's bright. 940 is up more red, right? And the 660 is more towards the blue direction, right? So deoxyhemoglobin tends to absorb that more. And so you take the signal from the photodiode and you determine the ratio of what's being absorbed more or less between those two wavelengths. And that'll give you a ratio of how much oxy versus deoxyhemoglobin you have in your blood. And you can correlate that to what we call the oxygen saturation of your arterial blood. So that gives you an idea of how much oxygen is in the blood. So there's people, so that is a way to measure empirically the cyanotic state, or how much oxygen in your blood.
You didn't tell them what numbers they should be getting.
Well, I try to avoid that because there's always error with the thing. Those things are only like 5% accurate, or there's only close to 5%. So I don't want you to get scared. If you're above 90, you're okay. In fact, it'd be strange for you to be sitting here and not be above 90. Usually we say more like 95. Most people are more like 97, 99. But don't stress out if you're not. Because the fact that you're sitting here comfortably tells me already something. And you're pink and confused. So you also get heart rate that way. So a lot of times people are measuring heart rate that way too. So these are vitals that are very quick. You go to the doctor's office nowadays, they have these things. And that's how we do it. I mentioned Apple's watch. They talked about doing near infrared. So that's one of the things that they're talking about doing, is putting near infrared into various different devices. So I mentioned visible light only goes like tens of microns deep into the skin, into the body. Near infrared, because it's longer wavelength, can go a little bit deeper, go down to muscle. And so they're actually doing things about with that, with like muscle oxygenation, so sports medicine people who like, NFL level kind of stuff, or maybe Olympic level, maybe in college, are looking at like how muscles are oxygenated and how to improve that, things like that. They do that with near infrared. There's a couple other things they're trying, but nothing that I can think of has really come into mainstream clinical relevance. They do some optical light, maybe near infrared mapping of people, like similar to what the Kinect does, the Microsoft Kinect. Use that to aid treatment by seeing where the person is. That's still relevant. Because I'm on the topic, it's kind of separate, but blood flow is related to all this. Because where your blood flows, that's where heat goes, and so infrared comes out with heat. So you can get, nowadays, your temperature taken with an infrared thermometer. It's pretty convenient, except a lot of times what you measure is skin temperature, and when you really want to know what the core temperature is. So, but we don't really use something this sophisticated in medicine too much. There's people who've talked about trying to find cancers, like superficial cancers, like breast or skin cancers, by looking at how the blood flow changes as measured by how much heat is being emitted. But this is a thermal imaging system. I'll walk it around. Just talk like an appreciated with it if I dropped it or something. But so
Only
like this.
$5,000.
It's only $5,000. So here, lift up. Okay, see your hand there?
Yeah.
Now lift up your hand. Move it out of the way. It's on the table. See that? Yeah. So what's your food? Food warm? You okay with passing around? Well, Tom's here. If you drop it, you can talk to him. Here, play with it. So you can use that to measure temperature, various different engineering investigations, like Dr. Taylor's working on a microwave problem. He was using it yesterday for that. Tom was talking about leaks in your home. Lots of different ways. We were using on measuring the temperature on the bottom side of the plate falling on it. So it's not the most common thing to use in an engineering investigation, but it is a tool that's out there. So while you're playing with that, I'll talk about another aside. There are people who are blue that are always blue. It's not because of the blood. If you were to, so I didn't show you when I had the rubber band on, but with the rubber band on, it was all dark and stuff, right? If I push my finger, it would still blanch. That's what blanching is when it turns white. It's because I'm pushing blood out, and there's blood there, it's just dark. Well, there are people who are blue, and if you push on them, they'll still be blue, and that's because they took a medicine. Like this guy has amiodarone. It's kind of hard to notice, but around his mouth and chin, it's kind of like a grayish, bluish color. That's a side effect of this drug called amiodarone, often given for heart failure. And then there's people who take too much silver or gold. Gold salts is sometimes used in rheumatological conditions. Not a lot of pictures of those, but there's a number of people. Have you heard of colloidal silver? So it's kind of this health fad where people. So silver was honestly was used as an antibiotic in the past. It wasn't a great antibiotic and had some side effects. So I'm going to show you. And so that's kind of persisted in the public consciousness. And then people started saying, hey, I can make nano gold. So they're like taking a car battery and taking a silver salt solution and bubbling it out and precipitating silver particles. And dispersed it in a suspension and called it colloidal silver, and then they're drinking it. Well, silver isn't really metabolized that great, and it kind of gets sent to your skin. So these are real people. They're silver colored, right, or bluish colored. This guy here is Stan Jones. He was a Libertarian Party candidate for senator and governor of Montana. So he was actually popular in the early 2000s. So anyway, it's kind of a side, but it is a materials science kind of thing. So this is area. So blood also causes color when it's damaged, right? So if you have a bruise, everyone knows the colors of the bruise, the black and blue. That's deoxyhemoglobin, right? And then it fades because it breaks down. When it breaks down, it forms bilirubin. I'll talk more about that. That's a yellowish color. And then sometimes you might have what they call hemosiderin staining. The bilirubin turns into like an iron storage molecule called hemosiderin, and it has a brownish color. It kind of just sits in color tattoos. Sometimes you see that after a bruise. It's kind of faint. That may be what's going on right there on me. I purposely did not put up a picture of real gangrene. It's pretty nasty. The gangrene, the heme molecules get metabolized by bacteria and can form some iron sulfide or sulfide, which is a blackish color. That's why gangrene can turn really black looking. And that happens when the body part's dead. So that's damaged blood. I mentioned the hemosiderin. There's a state, it's actually one of the more common genetic disorders, but it's, when you have too much iron in your body, you don't get rid of it. And it's called hemochromatosis. So you can have extra hemosiderin in your skin, give you an extra brown color, give you kind of an extra tan. Sometimes it makes you a little grayish, but I've never seen a picture of someone who's gray from hemoglobin. It's usually more this bronze color is what they describe. So that's when blood breaks down, forming hemosiderin or what have you because of something out of the ordinary. But usually your blood is recycled. So red blood cells only live about 3 to 4 months. They don't have a nucleus. They can't really reproduce themselves like other cells do. And they get used up. They get beat up a lot because they're passing through your body and moving around. A lot of mechanical and other injuries to the red blood cells. So the body recycles it. Mostly in your spleen. There's over here. The red blood cells kind of get trapped in the filter system of the spleen if they're old. When they're old, they start losing the shape that they used to have and get caught in the vasculature of the spleen. And macrophages are kind of like the vacuum cleaner cells of the body come in, rip apart the red blood cells, separate the heme from the globin, and then they turn the heme into biliverdin. Verdin comes from verde, which means green from Latin, right? And the biliverdin goes to the liver, gets turned into bilirubin. Bilirubin is really yellow colored, but the rubin comes from red. They thought it was kind of reddish yellow, sometimes people describe it as orange. Bilirubin is part of what goes into bile. So is biliverdin. So, well actually bilirubin goes into your bile. So up here, that's your liver, and they peeled it back so you can see the underside. And that's your gall bladder, which is green. So it's green because of biliverdin. And so your the bile in your gallbladder gets excreted into your intestine, and it helps in fat metabolism. It binds up with fats and cholesterol and so on. And if you have a disorder, whether you're breaking up too many red blood cells, so you're making extra bilirubin, or if your bile duct is blocked, or your liver's got problems, you can build up too much bilirubin in your body and you have jaundice. And that's what jaundice is. Babies sometimes have jaundice when they're born, which is normal. So we give them a little blue light, which the yellow pigment absorbs, and it breaks down bilirubin faster. So I mentioned the bile gets excreted in the intestine. So the bilirubin is yellow, turns into biliverdin as it oxidizes in that process. That gets turned into urobilinogen, which is colorless, which turns into sterobilinogen, which is brown. And that's what gives your stool color. So normal stool is brown for that reason. Bacteria changes, is what changes those molecules from one to another. If stool passes through your intestine quickly, it tends to be more green. So if you have diarrhea or if you have lots of fiber, it tends to be more green. Obviously, if you eat a lot of spinach, it tends to be green because of the food too. But normal stools tend to be dark yellow, dark brown, sometimes green. Abnormal stools, if it's pale, you may have a jaundice. You may have the bile's blocked somewhere. It's not getting into the stool, so you can have this pale, sometimes people say clay-colored stool. If it's black or tarry, it's often because blood is being broken down and making this black color that I've talked about before. And that comes from bleeding in your stomach or your upper intestine. If it's down in the lower intestine, it doesn't have that time to get broken down by the bacteria, so it's still red. Or if there's lots of blood coming from somewhere, it doesn't get converted to the blackish color, it just stays red. Beets and Pepto can also discolor your stools. Don't worry if you eat that and you have red or black stools. Sometimes yellow stools, sometimes like babies have a lot of yellow stool. It has to do with the fat that they're metabolizing. Urine color comes associated with this too. So the urobilinogen is absorbed into the bloodstream and then gets excreted through the urine as urobilin, which is kind of a straw color. It's like the weak yellow color of urine. You can have a bright yellow color when thiamine, which is one of the B vitamins, gets broken down into thiachrome. So if you take a vitamin right before bed, get up the next morning, you have this bright yellow urine. I don't know if anyone's done that. I have. That's what's wrong. People care about urine. Cleveland Clinic published this whole thing about urine, which is basically what I just told you. Most of you need to be concerned if there's red. The other colors are kind of either rare or from drugs that if you're taking a drug, you should know about that side of it. But basically, the lighter the urine, the less dehydrated you are. There's even a website that talks about even more weird colors, urinecolors.com. People talk about since the Renaissance, they had these things called urine wheels, where like someone would look at the color of your urine and look at this little map, and it got to the point where people weren't just trying to tell what your health was, they were actually trying to predict other things, and so that's called uromancy. So divination based off of your urine. People care about the color of nasal mucus. So if it's clear, it's just your nose is running. It's not that big of a deal. If it starts getting white or yellow or down to green, you may have an infection growing. If it's red, there's blood. It's a problem. But it could be just your nose is dry, so you dehydrated, so you're not cracking capillaries. If it's black and you're not immunocompromised, you should see a doctor. Because unless it's because you're putting stuff in your nose. I was in Eastern Germany shortly after the wall came down, and in the winters, my mucus was black because of all the coal smoke. We don't have that in most countries anymore. There's a fungal infection that can cause you to have black mucus. If you see black mucus, you should probably get checked out. So, summary. You have melanin, it's brown or red. Carotenoids, which are yellowish orange. Heme, which is red or purple, depending on oxidation state. Bilirubin is yellow, biliverdin green, sterolinogen brown, urobilin straw yellow. So, what's the similarities between those molecules? Why are they colored? This is beta carotene. He's that example. It's kind of the simplest example. They're conjugated bonds. See that? Double, single, double, single, double, single. So it's not really double, single, double, single, double, single, right? You got these. It's been a while since I've taken a class, but who has had a class about color, right? So that you share the electrons through that bond. It kind of makes it so there's sort of conductive. So they're kind of like a semiconductor now. And so visible light comes in and interacts with it in a certain way. Because it's not a pure conductor, it doesn't reflect all the light out, but it's also not an insulator, pure insulator either, really. So the light doesn't just pass through. So it interacts with the visible light. And so some light is preferentially absorbed, some light is reflected, and that's how you get the color. And that's also why these molecules are so interesting, because they can take on electrons. So a lot of these molecules are antioxidants, which is kind of critical. So these are really cool molecules, these with conjugated bonds. And some of the most interesting biology comes from that, and that's what's related to color. So, what about your eyes, though? I didn't talk about your eyes. So, eyes are brown to green because of the melanin, but what about blue eyes? I did not mention the blue color pigment, right? What makes things blue? It's actually kind of hard to get things to be blue unless you start talking about crystals and defects in the crystal or something like that. Like the Hope Diamond's blue because of boron. It's not because of the diamond. It's boron impurities. So blue is kind of a special, there's lots of things that make blue, and they're all a little bit different. In this case, in the eye, it's called Tyndale scattering. It's similar to the Rayleigh scattering that you get from the blue sky, because at shorter wavelengths get scattered more. But in this case, Tyndale scattering is to do not with when there's atoms in the air, but rather with particles. So your iris actually is colloid in a way. There's like particles floating in fluid. It's kind of turbid. It's kind of like a jelly pack or something like that. As the light goes through it, the red light keeps going and is absorbed back in the retina. Whereas the blue light kind of gets scattered out, and that's what gets scattered to what we see, and so the eye looks blue. It's not really a blue pigment in there. In fact, if you have absolutely no melanin to cause any kind of that turbidity, the eyes turn red because all you see is the retina. And that's what, well, some albinos have red eyes. What you're seeing is the light going all the way to the retina, bouncing back and having that red eye that I talked about earlier. So, colors of the body mostly come from melanin and blood, some carotenoids and talk about blue eyes. The oxy and deoxyhemoglobin gives us pulse oximeters. And there's some other near-infrared applications that are in the works that are kind of cool. Get your sun by eating. Okay? And then next time we're going to start talking about sound, how you diagnose things with sound. All right? And then just because it's cool, I'm going to read a poem to you. It's by a physician poet. I know the color rose and it is lovely, but not when it ripens in a tumor. In healing greens, leaves and grass so spring-like, and limbs that fester are not spring-like. I've seen red-blue tints with hirsute mauve and the plum-skinned face of a suicide. I've seen white, china white almost, stare from behind the smashed windscreen of a car. And the criminal, multicolored flash of an H-bomb is no more beautiful than an autopsy when the belly's over, to show cathedral windows never opened. So in the simple blessing of a rainbow, in the beveled edge of a sunlit mirror, I've seen visible death's artifact, like a soldier's ribbon on a tunic tacked. That's from Danny Absey, who's a Welsh poet and physician who died last year. So that's colors. Any questions? No? All right.
Only a poet, only a doctor, a medical doctor can appreciate that poem.
Yeah. Yeah, it's an interesting poem.
I'll take it.
All right.
They make something.
Here's some case.
Snap on the back.